going to talk about urinary incontinence. This is the topic that most of the time people, women, are very uncomfortable to disclose, to talk, to discuss about it. And I would like to shed some light, but there's hope and there's actually a lot of solutions, and it's not necessarily surgery. There's a stress urinary incontinence, which is when leakage happens when you cough, when you sneeze. That's called stress incontinence. There's an overflow incontinence when you just can't hold it. You have urgency and you can't hold it, and then you start leaking. So all of these incontinences, it could be also incontinence due to urinary tract infection, chronic urinary tract infection. It could be also sometimes due to taking certain medications that make you pee too many times and then you just can't hold it. It could be herbs. People think that if I'm taking natural supplementation, it's all natural, it shouldn't cause any side effects. Well, certain herbs could have diuretic effect and create problems like incontinence. It is real, and there is nothing to be ashamed of. And I say, if you have this problem, talk to me. There's also another type of incontinence that a lot of patients also very, very uncomfortable to open up and talk is fecal incontinence. Unfortunately, fecal incontinence happens. Fortunately, it's not that common, but unfortunately, it still happens. Most of the time, it happens again due to trauma during childbirth, especially vaginal delivery. And in some cases, it happens due to chronic constipation. But let's say for urinary incontinence, number one, we always say Kegel exercise, right? But do we know how to perform Kegel exercise? First of all, Kegel exercise is something that you do on a regular basis. You have to do it often. You have to do it at least for a minute or two, and 2 to 3 times a day, 3 or 4 repetitions. And the way you do it, you hold the muscle of your vaginal area, you squeeze it, and you hold that squeeze for at least 10 to 20 seconds. You hold it and then you let go. You hold it and then you let go. That is your vaginal area. Also, it's very important to have this muscle recognition of that specific muscle that is responsible for urination. For example, when you are urinating and you're passing urine and then try to squeeze and stop the urine flow, just feel that little muscle called sphincter around the urethra. That's the muscle that you need to squeeze when you're not sitting on the toilet, when you're just sitting and maybe talking to a friend. But I would say I would rather not to talk to anyone when you do Kegel exercise, but focus on the muscle. And when you're focusing on the muscle, it's already proven you're going to get better results, not only with Kegel exercise, but with any kind of exercise. There's a lot of tools that you could put in the vagina, squeeze them, and create sort of like a resistance and train the muscle. A lot of them, and I'm not going to talk about them. You can play with them, but before you play, just ask me, make sure that it's all safe. Pumpkin seed oil is one of those very natural, very helpful and healthy ways of keeping urinary incontinence under control. It's good for your immune system, it's good for your health, it's good for your skin, it's good for your hair, and it helps with urinary incontinence. And then there is also some modalities that we use. For example, in my office, we have a modality called shockwave therapy. It's a probe that goes in the vagina and creates specific vibrations and removes debris from the muscle and brings the flow, brings the oxygen, basically brings tissue to life and brings muscle to life and stimulate muscle. It's not electromagnetic stimulation, completely different modality. And I just found out about another modality which I am going to test and see how it works. And that modality is actually for straightening of your core muscle, your pelvic muscle, your chest, your butt. It's an exercise, but one of the side effects of it is fixing urinary incontinence. I will keep you posted about that, but there's a lot of good reported cases with good results. But definitely divine wave therapy, shockwave therapy works. We have it available in our New York office right now. And very soon, like in a month, we're going to have it in our Jupiter office. So stay tuned. And if you have any problems, let us know. Incontinence is real. Incontinence is something that could be treated, not necessarily with surgery. You just have to voice it and you have to talk to me. One thing I really ask you, don't forget to subscribe and leave a comment. If you subscribe, I would know that whatever I'm doing, you need that information. I'm going to continue doing that. And also, I would love to have this channel to be interactive. I would love you guys to leave a comment and maybe give me suggestions. What other topics you want to talk about? And we're going to discuss them. And it doesn't have to be a medical topic. It doesn't have to be a gynecological topic. It could be anything. And stay tuned. We're going to have a lot of other interesting things coming out.